welcome back to my channel. So today's topic is gastritis. So let me give you some details about this particular issue, that is gastritis, what exactly it is, why these issues are usually seen, and what are the symptoms of this disease, the gastritis problems, and various diagnostic approaches to find out if you're suffering from gastritis, and some remedies. So basically, gastritis is caused by the inflammation that is caused in the lining of your stomach. We know that we eat food and the food gets digested in the stomach and in the intestine region. So here, when this is happening, there is a chance that inflammation can happening in the stomach lining, and this is most of the time this gastritis issues is caused by bacterial infections. So Helicobacter pylori, this is one organism which is commonly causing this issue. Apart from that, sometimes these issues are caused by taking consecutive pain relievers. So we have a small pain, we start taking tablets. So too much of these tablets can lead to these issues. And again, too much alcohol also sometimes can lead to these issues. So certain times this can be acute, that is all of a sudden you might suffer from this kind of gastritis. But certain times it can be chronic. So where on a period, like you're continuously taking tablets, so on a long run you start developing this gastritis issues. So what happens is, as such, gastritis is not very complicated. But what happens is, if this continues, it can lead to a lot of ulcer formation in your stomach and in the intestine region. And these ulcers, if not taken into consideration, if you do not give proper treatment, it can lead to various other issues like cancer. So stomach cancers can be seen in the later stages if gastritis is not taken seriously. So just to show you the pathogenesis, like what exactly happens. So in case there is inflammation that is happening because of gastritis, during this condition, what happens is the somatostatin, there's a decrease in the production of this somatostatin. So what happens is this somatostatin and gastrin are inversely related. So once there is decrease in the production of somatostatin, there will be increase in the formation of gastrin. So gastrin is acidic condition which is produced. So this will in turn lead to a lot of histamine production in your body, because our immune system becomes active. Because we have already studied that once there is inflammation, your immune system becomes active and it starts producing histamine. So same thing is happening even here. And once histamine production happens, it will insist or direct the parietal cells to produce a lot of acids. And these acids, once they are formed, it can lead to a lot of issues, and later it can lead to these ulcers, and later it can lead to even cancer. So in this way, there can be a pathogenesis. So in case we can try to block this somatostatin somehow so that there is no increase in the gastrin production, then we can try to avoid. So this is again to show you the levels of acid production. So this is low level and high level. This is high level. So as the acid production is going to increase, so this might be because of infection by Helicobacter pylori. So once this infection happens, once the acidity becomes more and more, the chance of growth of this organism increases, because this organism growth is favorable when the pH is acidic side. So once you're suffering from gastritis, the chances of this spreading in your system becomes even more, and that leads to a lot of ulcer situations, and finally these ulcers can even lead to cancer. So coming to the causes of gastritis, it is basically because of unhealthy diet. It is because of too much of alcohol. It can be because of these infections by Helicobacter pylori, or it can be because of too much medicines. So taking too much medicines also can lead to gastritis issues. Coming to the symptoms, you might be suffering from heartburns, you might feel too much heaviness, you may have pain in the abdominal region, and you may even have vomiting. So these are few symptoms of gastritis. So we already saw about some symptoms. So abdominal bloating you can have pain, you can have indigestion issues, you may have a lot of hiccups because of the gas in you. You may have loss of appetite, and certain times you may even have tarry or black stool. So these are few indications that you are suffering from gastritis, and you need immediate attention so that you can come out from this particular situation. So basically you need to consult a gastroenterologist So these are the specialists who can help you with gastritis issues. So there are a lot of over-the-counter medicines available, but if you cannot find relief with those medicines, then it's better you consult these experts, and in that way they can try to help you out with this particular situation, so that it does not end up in this kind of ulceration or even cancer. So certain times you may even vomit blood, or blood might be available present in the stool, or your stool might be black. So these are few indications that you are suffering from gastritis and you need immediate attention. So coming to the risk factors, as I told you, the most important thing that causes this is bacterial infection. And in the bacterial infection, that is the Helicobacter pylori, which is leading to these issues. And too much of pain relievers like aspirin and other things on the long run can lead to this gastritis issues. And even with age, this can start, because as you age, your lining of the stomach and other regions becomes thin, and this can be a reason for ulceration. Apart from that, excessive alcohol use can lead to issues. Too much stress also can lead to these kind of issues. And certain times what happens is your body starts attacking your stomach cells by itself. So this is really a complicated situation. So this will be called as the autoimmune gastritis. And certain other complications like HIV, AIDS or parasitic infections also can lead to these complications. So coming to the complications of this particular issue, so you can see a lot of ulcers. So this is just to show you the ulceration. Okay, so by doing an endoscopy, this can be analyzed. And this is how further, if ulceration is not taken into consideration, if you're not taking suitable treatments, it can even lead to cancerous situations. So this is the thing to show you that. So coming to Helicobacter pylori infection, as I told you, this can be even transmitted from one person to another, or it can be even transmitted to the contaminated food and water. So if you're drinking any water contaminated with Helicobacter pylori, or you're eating food which is not cooked properly, this can lead to those issues. So as much as possible, it's better to frequently wash your hands with soap and water and eat food which is properly cooked. So these are a few precautions that you need to take so that you do not end up in gastritis because of Helicobacter pylori. So coming to diagnosis, we can do a endoscopy, as I told you. This is just to show you the image of interior endoscopic image to see the interior lining of the stomach and other regions, where you can identify if there are any ulceration happening. So this will be a good test. Apart from that, even blood test can be done and stool test can be done. And even they do certain breath tests. So let me give you more details on that. So this is how the breath test will be done. Basically, they'll give you a lemon flavored solution, and this solution will have urea. Okay, so in case you are having this gastritis issues because of Helicobacter pylori, this organism has a particular enzyme called as urease, and that will break down the urea present in the liquid that you take into ammonia and carbon dioxide. So the amount of carbon dioxide released will be estimated. So in the normal breath, we have a particular amount of carbon dioxide that comes out. But once you are infected by this gastritis and you have taken this solution, the amount of carbon dioxide released will be much higher. So comparing with the baseline value, they can get to know if you are suffering from this gastritis, which is caused by Helicobacter pylori. So this is how the breath test can be used for analysis. And this is just to show you the endoscopy which can be done. So this is how the endoscopy image will be taken. So here there will be a camera which can be helpful for seeing the inner lining of the stomach and other regions inside. So this is how it will be done. So you can monitor it in the screen. So you can see if there is ulceration. So those kind of things can be analyzed using this endoscopic technique. So coming to treatment, a lot of antibiotics are available for Helicobacter pylori. So here you have to be very careful. So whatever prescription is given, so the antibiotic treatment, it might go from 7 to 14 days. So you should not skip it in between. So in case it is given for 7 days or in case it is given for 14 days, you have to complete the course. Even if you feel that you have relieved from these symptoms after 3rd day, still you need to complete the course within the 7th day or 14th day as told by the doctor. Because this is very important to complete the antibiotic courses. Otherwise, again, the infection might start in the long run. Apart from that, there are certain medications which can be given to block this acid production. So we have seen that acid production is the main reason for all these gastritis issues, because once the acid is produced, it acts on the cells and then there can be ulceration. So if you can block the acid production somehow, so there are certain medications for that also. So once you block this acid production, you can try to avoid the gastritis that is happening. Similarly, there are certain antacids. So this will neutralize the stomach acid. So once acids are formed, if you take some antacids, they will neutralize the acidity. So that is how the gastritis issues can be avoided or prevented. So apart from that, certain times if you are anemic also, it might lead to gastritis issues in some people. So there they might suggest you vitamin B shots. So even if you are tolerant, okay, lactose tolerant, so those kind of people, there is the chances of suffering from this kind of gastritis, because lactose cannot be broken down in your body properly. It can lead to gas formation. Similarly for gluten from wheat. So in this way, if you are these kind of people who are lactose intolerant, please see to it that you do not include those items in your diet. So coming to lifestyle and home remedies, so it's better to eat smaller quantities and infrequent times, because if you skip in between, there's a chance that more acid formation happens in your body, and that can lead to a lot of gastritis issues. So this is the major issue seen in most of the people. Because of too much work and stress, they skip some of the meals in between, and on a long run this is definitely going to lead to this problem of gastritis. So as much as possible, see to it that you have your food in regular times. And apart from that, it's better to avoid irritating foods like too much spicy, too much acidic kind of food. And alcohol should be taken in moderation in case you're taking it. Too much of this can lead to issues. And when you have this acidity problem, you can have a little bit of lime juice, which can help you in coming out from the acidic condition. And in case you feel that because of the painkiller that you're taking, pain relievers you're having this gastritis issues, you can see to it that you switch over to different pain relievers and see if that is helping you. But as such, pain relievers should not be taken on a long run. So these are some Ayurvedic medicines which are available. So Himalaya, they have their product called as Himalaya Gasix, which has got very good reviews. Apart from that, even Munial Ayurveda, even they have their product called as the Muna Acid. So this is also a very good tablet which can be used, which is economical. So this will help you in coming out from this gastritis issues. And most of these are using herbal medicines and basmas of various things, which will be useful for avoiding this gastritis situations. Apart from that, even Kapiva, they have their product. So this is the Kapiva Digestive Care Juice. So this has basically amla, jeera and ajwain. So these are very good for digestion. So in that way, in a long run, this will be very useful. So it's a liquid which you have to just mix with water and take it twice a day after meals. So this is very much better compared to the antacids, because antacids, when you take, there are a lot of chemicals and you may have a lot of side effects because of that. In comparison with that, this is a natural product where amla, jeera, ajwain, those kind of things are there. So definitely it's going to be a long-term relief, and it can be recommended to anyone. But antacids, depends on the other conditions also. Other medical conditions need to be considered when you are suggesting antacid to some people. So this is a good product which can be tried. So coming to the takeaway messages, we have seen how basically gastritis issues is seen. So when you eat food, basically you will be consuming air also when you are eating. So this in turn leads to this kind of gas problems. So if it is released from your body with burps and things like that, then the chances of these gastritis issues will be much less. So as much as possible, the foods which are leading to gas, you try to avoid those. So that will be in turn helping you. So apart from that, simple walking or yoga can be used so that you can expel the trapped gas in your body. So these trapped gases are leading to most of the issues. So if you can use simple walking or yoga kind of things, it might be useful to you. So basically, it's better to consult your gastroenterologist if you feel that you're not getting relief from the over-the-counter drugs, and see to it that you avoid these unnecessary ulceration and other complications like cancer. So stay vigilant, stay safe. So these are some products or vegetables basically, and even dairy products which are usually leading to gas. So if you feel that you are prone to this gastritis issues, it's better to avoid these kind of food in your diet. Thank you for watching. If you have not yet subscribed to my channel, please do subscribe to my channel. Please like this video and please share this video with maximum people so that if anybody is suffering from this gastritis issues, this video might be of some help to them. Thank you.